Hello, everyone, and welcome to my presentation of Emergencia, Bilingual Emergency Preparedness and Crisis Management in the Modern World. As a lifelong Southern California resident, I wanted to highlight disaster preparedness and emergency communications during the annual wildfire season in California, which became newsworthy this past summer when a family had a pyrotechnic gender reveal that consequently caused what is now known as the El Dorado Fire, capping off a fiery California summer. Readings in Unit 12, Special Populations, gave me a better understanding on how to formulate a topic. The National Council of Disability reading exposed how disabled and other special populations were unaccounted for during Hurricane Katrina. And this resonated with me as special populations are a unique and important aspect of American society. In my CIIR resource, I came across an article that analyzed the lack of bilingual emergency communications during a 2017 fire. I found it to be a failure that in counties where Latino populations reach up to 40%, local officials were unequipped with multilingual emergency alert systems. Neither fires nor the state's Latino population are recent phenomena, so why hadn't county emergency officials prepared bilingual emergency communications? The significance of this topic is that society is becoming increasingly heterogeneous and diverse. In the United States, for example, local officials should implement emergency contingency plans that account for its local limited English proficiency or non-English speaking populations. As seen in the figure, Asian American LEP populations reach up to 74% of the population in some countries. The next slide here highlights the most common languages spoken by LEP populations, a majority speaking predominantly Spanish, Chinese, and Vietnamese. So how are various LEP populations affected before, during, and after a disaster strikes? What are local officials doing to account for this special but significant LEP population? A review of the literature reveals how local county and state officials have prepared or neglected various groups of LEP or multilingual populations for disasters, crisis management, crowd management, and even binational national emergency contingencies. The thesis here is that local health and emergency officials should have an understanding of the diversity and increasing heterogeneity of the populations under their jurisdiction for proper crisis preparedness. The first case study focuses on North Carolina's migrant seasonal farm worker MSFW population. The history of MSFW in North Carolina and the United States is abundant, as MSFW from Mexico and other Latin American countries rely on seasonal farm work for their family's well-being. It is estimated that 3 to 12 million MSFWs reside in the United States, and specifically in North Carolina, ranked 6th in the country for highest MSFW population, inhabits approximately 200,000. Limited English proficiency and rural residences make for a dangerous and especially vulnerable population in the event of an emergency or crisis. Not only are these populations vulnerable, but as a largely immigrant MSFW population left ineligible for federal aid. Rosenbaum and Long reveal that FEMA offered free disaster preparedness training for community volunteers across the country since '93, but not specifically for Hispanic MSFWs. In research of the Northern American states, the lack of bilingual FEMA certified trainers located in rural areas seriously hinders the ability to reduce the disaster preparedness training disparities that exist in the MSFW population in the places where they work. The next slide highlights Chinese limited English proficiency populations in the US. According to the US Census Bureau in 2010, the population of non-English speaking immigrants grew by 140%. And in 2008, the same population increased to almost 1/5 of the population, with nearly half reporting speaking English less than very well. Despite the increase of Chinese LEP populations, studies by Yip et al. And Eisenberg et al. Reveal that Chinese LEP populations are relatively uninformed regarding the use of 911 and CPR for emergency situations, with consequently rising cases of cardiac arrest in the specific community. Eisenberg et al. Studied the effectiveness of culturally adapted graphic novellas using graphic visuals to inform LEP populations in the event of a 911 emergency. The use of graphic novellas previously tested on similar populations have been found successful, as the novellas have been shown to increase awareness, knowledge, and positive intentions to make health behavior changes. The effort to inform LEP populations through graphic novellas as an accessory to CPR training, in which such training is scarcely available to minority populations in languages other than English. Of the millions affected during Hurricane Katrina, it is estimated that 300,000 Latinos residing in the Gulf Coast region were affected. Research from Macias and Lacey reveals that the Gulf Coast Latino population, specifically those with little to no English proficiency and undocumented immigrants, were left vulnerable before, during, and after the disaster. The 2005 census showed that nearly a third of Spanish-speaking residents in New Orleans spoke English less than very well. However, Latinos revealed that language barriers and lack of access to storm information and personal safety advisories were among the many challenges Latinos experienced as Katrina approached. Following the hurricane's destructive path, millions sought refuge through government and non-governmental aid and relief organizations. Of affected Latinos, many undocumented immigrants were left unqualified for most types of federal assistance, with the Department of Homeland Security informing anyone that needed assistance to seek it from all agencies. Many undocumented Katrina evacuees were threatened with deportation. FEMA offered undocumented immigrants temporary assistance, but no financial or housing aid. Red Cross facilities sheltered many undocumented Latinos, but many cases surfaced of forced evictions and threats of deportation. In the state of California, there are two things that are longstanding: wildfires and a substantial Latino population. Eisenman et al. Found that of the Latino population in Southern California, which makes up for 30% of the region's households, still report difficulty obtaining culturally relevant Spanish language disaster communications. With frequent seasonal wildfires, health departments and local officials should account for this vulnerable populations to prepare for emergencies. When seeking disaster-related information, materials are often written in English only and at reading levels above those recommended for populations with a high prevalence of low literacy. Official response to the 2017 Thomas Fire revealed that local counties had neglected their LEP populations as emergency communications were broadcast solely in English. The fire affected Central California counties where populations of Latinos reached up to 45%. In Sonoma County, officials struggled to push out timely alerts and information in both English and Spanish, and in response, local Spanish radio stations provided consistent emergency messaging to listeners. In Napa County, where local Latino populations reached 30%, emergency communications were broadcast in English only during the same fire. Crises and natural disasters know no borders, and in this case, forces bordering nations to collaborate on emergency contingency plans despite the history of the two nations, border disputes, and language barriers. In response to the 2011 Japanese earthquake, tsunami, and Fukushima radiation leakage that washed up along the shores of Mexico and the US, forced the two nations to create a binational emergency response. The goal of this contingency is to provide an emergency response to a chemical hazardous substance contingency or emergency that may present a significant threat for both participants or that affects one of them in such a way that justifies the notification of the other participant or request for assistance. In an effort to localize the communications, this contingency plan identifies four primary stakeholders: 2 county offices in San Diego and 2 in Mexico. As of 2019, however, the only agencies that do not have reliable bilingual capabilities is the San Diego County Office of Emergency Services and the City of San Diego Office of Homeland Security. When the groups meet, translators are provided for all 4 groups to ensure fluid cooperation, and bilingual points of contact are established for immediate action. The annual Hajj pilgrimage of the Muslim faith is the largest and most complicated annual crowded religious event in the world. With 2 million pilgrim attendees from over 140 countries and need to complete the pilgrimage rituals within a prescribed time and in unison, crowd management efforts by local officials give valuable insight as to how large, heterogeneous, multilingual populations are managed during the annual pilgrimage. There is certainly a threat of a crisis or emergency with past instances of stampedes killing hundreds of lives in both 2004 and 2015. How have Hajj authorities dealt with crowd and crisis management in preparation for annual Hajj pilgrimages of the future? Most Saudi employees interact with pilgrims primarily Arabic, with a few speaking English as a second language. Communication with a large percentage of pilgrims from non-Arab, Asian, and African countries that do not speak Arabic or English is impeded, making it difficult for authorities to share critical information with non-English or Arabic-speaking pilgrims. However, recent tech developments have aided Hajj authorities and pilgrims equally, as the Ministry of Hajj and Umrah developed a smartphone application called Manasakina, translated Our Rituals. The app is available in 7 languages to equip pilgrims with information about Hajj, rituals, satellite-based maps of Mecca and Medina, emergency contact information, and other valuable information. Hajj authorities have also implemented pictorial representations, photographs, symbols, and printed materials and signage as effective in reaching out to illiterate or low-educated people, while mobilizing bilingual staff and organizing public outreach events as common practices employed at the community level to circulate and explain warnings about potential risks. As seen in the various case studies, we see various ways local officials can improve their communications with diverse multilingual LEP populations. We've seen trials of graphic novellas to inform Chinese LEP populations on CPR and 911 training, bilingual emergency communications efforts, transnational emergency contingency plans between Mexico and the US, and a multilingual smartphone application that effectively manages multilingual and multinational Hajj pilgrims. This is just a start, and there's certainly much more improvement needed to prepare heterogeneous multilingual societies for crisis. Thank you for following along, and I hope you enjoyed my presentation.